is Virginia Goodwill, and I am going to be presenting to you today about something called FTT, long-term failure to thrive. Failure to thrive happens in a good portion of premature infants. There was actually a study out of the University of Arkansas that in low birth weight preterm infants, out of 914, 19.7% of those had severe issues with FTT, and then a little over half had minor issues with FTT. Failure to thrive is something that when you're a preemie mom, you don't get brought up to you right away, and then it kind of gets thrown at you for fun. I myself was a preemie mom. I had a baby at 29 weeks. He is now 14 years old and he's doing okay. He does still have some setbacks from the FTT, but I'd like to explain it to you a little bit more, and maybe if you do know some preemie moms or someone who might be pregnant, you could just let them know a little more about it, because in hospitals they fail to accommodate mothers in that way. FTT is labeled when a baby is on the World Health Organization scale, which ranges from 0% to 100%. It measures weight and it measures length of the infant. They usually use this scale for the first 24 months. It's usually done in 12-month increments, or at least my kids were. And when the little line goes up on the scale because they're growing and gaining weight, everybody's happy, and you fall anywhere from the 25th percentile to the 100th percentile. Usually the 25th percentile to about the 75 percentile is normally normal range for infants. When you get an infant with FTT, then they start to go up, 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 and then that line just levels out. And then sometimes it starts to go down. My son fell in the 3rd to 4th percentile. FTT is categorized between 3 and 5%. Once that happens, then doctors start looking at you, and they start wanting to know what you're doing as a parent that could be causing your child not to thrive. It's not always the parent's fault, but in our day and age, and unfortunately in our health society, that's who it gets aimed at, or at least that was my experience. So FTT is divided into 3 different categories. One is organic, one is non-organic, and one is mixed. The organic category is where there's something wrong. It's a sickness, an illness, a genetic disorder, something that is causing the child not to be able to absorb the nutrition from the food. So anything that's going into their body is not getting absorbed properly, and it's not allowing them to grow and gain weight as they should, according to the World Health Organization little rainbow that your children are supposed to stay on. Then there's the non-organic. The non-organic is where your child is eating, but not eating enough, or not eating enough of the right things. So it's usually caused by poverty. We see a lot of FTT in foreign countries where there's not enough food to feed the children. FTT is very prevalent there. Or even people in the United States, unfortunately, that don't have enough food to feed their children, then FTT, the non-organic form, will show up and it'll pop up. Then there's the mixed. Most people who have FTT have the mixed version. It's a combination of something. And normally it's that organic causing the inorganic. So my son, when he was diagnosed with FTT, he was consuming milk, but he wasn't consuming enough. FTT normally hits preemies between their 8th gestational month and a year. But since Jacob was born at 29 weeks, at 6 months old, he hit that gestational 8-month mark. So he ended up getting RSV at 6 months. It's a respiratory virus that highly impacts infants. When he got that, then number one, he stopped eating as much because he was stopped up and wasn't able to. The mucus in his stomach wasn't allowing him to absorb the nutrients like he should. And then something changed in Jacob when that happened, and he wasn't able to absorb nutrients from milk anymore. He developed a little bit of a lactose allergy that we didn't know about. So not only was he not able to drink enough and consume enough, he also wasn't able to absorb the nutrients from it. It was all due to the RSV. What we also discovered with the RSV is when they did his chest x-ray, he had a deformity in his throat where when he would swallow, some of whatever he swallowed would go into his lungs instead of into his stomach. So now we have 3 different complications. He's sick. He's not absorbing nutrients properly because we have a lactose allergy now that we didn't know about. And also about a quarter of what he's eating is going into his lungs and not into his stomach. So with that diagnosis, then they stopped looking at me and they actually started looking at the problems. They had run all kinds of labs on Jacob, but all the labs always came back negative because there was nothing wrong with him as far as viruses or sicknesses or illnesses or genetics go. It was simply a malformation of something in his throat that was causing things to go into his lungs. A lot of the underlying causes are the things that the doctors miss. They just kind of overlook, and the doctors were making me journal everything that I fed Jacob. They were telling me there was no way I was feeding Jacob that much food and him not thriving. Like, we don't label a child FTT when the mother's actually feeding them all of this food. That doesn't happen. When they finally found the diagnosis of his swallow function disorder, we were given a speech therapist. The speech therapist was very understanding. She understood everything we were going through, and she helped us through the process. So with all 3 of those together, then we had the mixed form of FTT. Finally figured out, finally diagnosed. We moved on to learn that a lot of people are overlooked with FTT because their socioeconomic status, or they can't afford a speech therapist, or they can't afford the x-rays. And so a lot of children will end up just diagnosed with pneumonia who actually have the same swallow function disorder that Jacob did. I would love to see a change where when you have a premature baby and you end up in the NICU, that they give you all this information to begin with. If so many preemies are going to be diagnosed with FTT and that failure to thrive and end up falling in between that 3 to 5 percentile and having their mothers watch every other baby's World Health Organization scale go up and their babies go and stop and just plan out and feel like it's their fault and internalize it, instead of all that having to happen, I would love to see more information on FTT, maybe in a little pamphlet that's given to a mom when a premature baby is born. They remind you of your oxygen, they remind you of your apnea Brady monitor, they have you take your baby CPR, they have you do all of these things and check all these boxes, but that FTT, that failure to thrive box, is just not checked. And it's so important. Thank you for listening. I hope you learned a little bit from it. Hope maybe you can help someone and reach out to someone if you feel like they're having the same problem. Thank you.